This month, we are likely to see an exponential increase in cases. That said, we actually welcome even the decision to hold a summit between the two levels of government to ensure that the directive to set up 300-bed isolation facilities in each county is achieved. With that, we equally as KMPDU state that the infrastructure setup is important, but more important is the human resource function and the human resources required to run these facilities. If these facilities are set up in our current scenario, where the healthcare workers are in their current numbers, they are not yet enough, then we will still not be able to achieve the desired outcome. A total of 81 healthcare workers across different areas in this country. And 60% of these healthcare worker infections are workplace related. That is in the quarantine centers and contact with COVID-19 patients in the hospitals, either knowingly or unknowingly. And by unknowingly, I mean a patient comes with symptoms, you attend the patient, and when the results come back later, the patient has tested positive.